Hi everyone, welcome to Camille's Holistic Health Show. I'm Dr. Camille McClellan, and I'm here to talk to you today about an integrative approach to dealing with IBS. And I'm not sure if you know exactly what IBS is, and maybe you do because you do have these symptoms and you're looking for better approaches to your symptoms, or you want better solutions. But IBS is an inflammatory bowel syndrome, and syndrome being that it's not really a disease, it's actually just a combination of symptoms that are actually very subtle, and a lot of doctors cannot get a grip on exactly how to help their patients with IBS. So again, it's an inflammatory bowel problem that is a functional a problem that actually affects the digestive system. So let's get into exactly what it is, how you can, there's different symptoms that it comes with, and how you can help yourself with a more of an integrative approach. But first, please subscribe to my YouTube channel, hit that bell so you can get notified every time a new video comes out. So let's dive in and let's go into a little bit about how many people have IBS today. I mean, 60 million people, maybe a little more than that, suffer with this inflammatory digestive problem in the US, and that's only in the US. There are so many more all over the world. And the smart thing and the great thing about it is that a lot of people are able to look for these solutions and take action, and an integrative approach is really a fantastic way to go. So a little bit about IBS. The symptoms can be, very hard to take on. I mean, lots of clients and patients have this problem, and they have to deal with it every day for hours, depending on how they eat, depending on the stress and the emotional situation that's going on in their lives. So if this is something that you are suffering with, this is a great video to take a look at and then put it into action. So IBS symptoms come with bloating, gas, mucus in the stool sometimes. It can also be diarrhea or constipation, or both. So those are the common symptoms of IBS. There are just a few more, but those are the main symptoms related to IBS. Now let's go into the different types of foods that can actually trigger IBS. A lot of allergies in the air, or allergens, could be in the environment. It could be in the foods that you eat. It could be nuts. It could be high levels of fat and refined sugars. Those are things that can actually trigger IBS. Dairy and also wheat is another food that can actually trigger IBS. And when we talk about the different types of problems that actually trigger IBS, this could be, your emotions. It could be a lot of stress. So you want to manage your stress with different things like hypnotherapy, if that works for you. Sedentary lifestyle, again, is a problem that many people deal with because they work, they are a little older, so they don't tend to be active. But again, for IBS, this is very a great way to alleviate a lot of your symptoms. Now, if you are you love a little bit of alcohol and you may smoke, you want to reduce that. Probably it would be beneficial if you eliminate it. And caffeine. I know it is something very hard to come off of, but these things do reduce a lot of the movement in your bowels because it causes dehydration. So you want to drink a lot of water. If this is something, caffeine is something that you really do want to keep going with, it's important to drink a lot of water. And SIBO. This is a small intestinal bowel overgrowth, and this can be due to an infection in your small intestines. And you want to take a look at maybe going to an integrative or a naturopath that can actually help you with eliminating a lot of that. So they'll give you a lot of natural ways to help alleviate SIBO if it's something that you do have, or leaky gut, which is an inflammatory, and a lot of people who have inflammatory bowel syndrome most likely have an inflammatory trigger there that causes a leaky gut. So again, this is great to know, and any nutritional deficiencies you want to check for as well. And like I said, foods high in processed, foods that are highly processed and low in fiber. So those are great ways to just see whether those are the underlying causes of your IBS, your inflammatory bowel syndrome. Now, when we talk about relieving stress, it's something easier said than done, but I can't tell you exactly what you should do. You need to find out what works for you with your IBS, because everyone, like I've always mentioned, is so different. Everyone comes with so many different their body and their makeup is just genetically as well is also, and their environment so different. So it is important for you to see what works for you. But hypnotherapy does seem to help improve IBS symptoms. Mindfulness, or so a mindful practitioner can help you, guide you into alleviating a lot of your stress. Biofeedback someone with biofeedback training would be great also to take to look into. And then when we talk about medications, some often use medications to lower a lot of the inflammatory symptoms. And just to make mention that medications can also affect your IBS as well. So take a good analysis of that. Make sure that your doctor can help you take an analysis of that, and to get you on the right track as to which medications work for you and which actually trigger a lot of your symptoms. And some medications that are used for IBS are diarrhea, anti-diarrhea medications, ones for gut spasming, because that's another symptom related to IBS. Some people have spasming of their colon. Fiber supplements, and we're going to go into a little detail of that, and nerve pain medications. Some use antidepressants, and supplements, dietary supplements. But many people with IBS, I do suffer with that myself, tend to get triggered by medications. And the more medications that you're on, the more the inflammatory response occurs and the symptoms occur as well. So in my experience and my experience with my clients, it's also very important to look at the medications, and the less medications that you're on for your IBS is always better, and it's always seems to be a better bet to go into a more natural approach. And so when we are looking at the foods and the different types of foods that ones should really get into and have I call it an IBS diet food list, and you want those vegetables to be steamed. You want those vegetables to be nice and soft so your digestive system can really devour it very, very well. And a probiotic is actually what will help you with the healthy bacteria in your tract, digestive tract. A good digestive enzyme is also a key, and healthy fats like avocado and avocado oil and olive oil, and fruits of all types. Great natural fibers to get into the digestive system. Bone broth is also fantastic with the collagen, the amount of high collagen that's in it. And anything, if you can consume raw cultured rather than milk coming from cow, that is also a good dairy to digest. And anything with lean meats, grass-fed beef, turkey, would be also beneficial. And I did mention all the foods that you should stay away from. And also you want to look at the natural ways. I had mentioned the probiotic digestive enzyme. L-glutamine powder is also something that I use. You can mix it into a smoothie in your morning, and aloe vera juice. It's fantastic. You want to look into that and do some research. And I always add something like flaxseed or flaxseed powder to my juice or my smoothies in the morning. And chia seeds, and also great teas. I always start off with a great tea in the morning, like chamomile or ginger, fennel, or something with lavender in it. Great teas for IBS or inflammatory bowel syndrome. And then when you want to combine it in the nighttime, it's great to use essential oils. And a lot of times that I use my essential oils, I also use the similar teas. So fennel essential oil is great. Lavender essential oil, fantastic. Chamomile essential oil, great for IBS. And also ginger essential oils. Okay, so I talked about the foods. I talked about the triggers, especially stress and your emotions around your inflammatory bowel syndrome. And I also talked about natural ways to overcome a lot of your symptoms. So, go in, dive deep, try to take action to eliminate your symptoms, and do it in a more natural approach. And like I always mention, an integrative approach, or a more personalized, individualized plan is always important, because what is good for one person may not be good for you. So what you're reading, what you're doing every day, is great. You're taking action. But what's more important is to find the real relief through what can actually benefit you as an individual. Thank you so much for listening, and I will talk to you next time. Bye now.